The hip hinge is one of the most effective movement patterns that you can use in the gym, but it's also one of the most commonly butchered, and oftentimes people stay away from them just because they have low back pain when they do them. But there's a lot of ways that you can avoid this low back pain just by changing up your technique. Okay, so to start off, the hip hinge is used in exercises like kettlebell swings, deadlifts, RDLs, single leg RDLs, and even on things like jumping. So it's a really important movement pattern. When you do a hip hinge, one of the most important things to think about is the activation of your glutes and your hamstrings. A lot of times, what people will do is they'll actually bend over and arch their low back. Okay, and when you do a hip hinge, that's not necessarily the goal of the exercise. That's going to put a lot of strain on the low back. When you're doing a hip hinge, what you want to think about is actually sitting back into the hips. So it starts from the ground up. What you want to think about, having your feet about shoulder width apart is best, especially for things like deadlifts. Now on a kettlebell swing, you'll probably open up a little bit and have a little wider stance just so you have space for the kettlebell. But for things like deadlifts, what you want to think about doing, screw your feet in the floor, bring your feet just where you would if you were jumping as high as you possibly could. Okay, so like a squat, a lot of times people get wide, but hinges and deadlifts, it's best to have your feet underneath the hips, pointed straight forward. Then what you want to think about is initiating the movement by kicking your butt back. But the first thing you want to think about is getting rigid. So put the tongue on the roof of the mouth, brace at your trunk. Think about getting the elbows back behind us, and that's going to be for all movements. Okay, so think about twisting the bar in your hands or twisting that kettlebell in your hands so that you get the elbows in, and then we create lat tension. Okay, from there, what we're thinking about is sitting in our midfoot. You're going to soften your knees. Okay, a lot of people will extend their knees and bend straight over and arch the back. Okay, and that's when you get the strain on that low back. What you want to think about, soft knees, initiate the movement by kicking the butt back. Okay, back, back, back. As soon as you feel a pull in the glutes and hamstrings, you're going to drive back up and squeeze. Now, if you're struggling with your hip hinge, a really good drill that you can start to incorporate is our wall hip hinge, which you can find actually in NISM, and there's an instructional video to go along with it. But what you're going to do with this drill is actually stand about a foot away from a wall. Make sure it's a supported wall that you can lean into. And you're going to do those exact same principles I was just talking about. So the tongue's going to be on the roof of the mouth. Okay. Chin's going to be tucked back, flat back, staying rigid. And then what we're going to think about is with no weight, you're just going to think about softening your knees and then kicking your butt back until it touches that wall. Okay. If you can start to teach yourself to kick the butt back and touch the wall without arching the low back, you're going to find that you use your glutes a heck of a lot more in the movement. Okay. Another thing to think about is when you're doing a hip hinge, you're not trying to get a stretch. Okay. So no matter what, we're always thinking about muscle contraction, not necessarily stretch. So as soon as you feel that pull in the glutes and hamstrings, you've gone far enough. Okay. So main things to think about, keep the back flat, tongue on the roof of the mouth, keep a neutral spine, and initiate everything back into the hips, maintaining those soft knees. Okay. Chest is going to come forward. Okay. So don't try to keep your chest up and your head up the entire time. It's going to move on that axis. So as the hips are breaking, the butt's going back and we're bringing that chest forward. If you feel any strain in your low back, you're doing the exercise incorrectly. Okay. So take this advice, take it to the gym when you're doing your hip hinges, and I hope this helps.